Looking for adaptive equipment to help make catheterization easier after a spinal cord injury? In this video, I'll walk you through different types of AE that support bladder management, tailored specifically to SCI level. Whether you're an OT learning the options or someone living with SCI, there's something here for you. Let's get into it. Welcome back to video 6 in the series as we explore the role of OT in BBM. I'm Julia, and today we're talking about AE that can help your clients maximize independence with toileting routines. If you're just joining us, here's a quick overview of how we've grouped SCI based on hand function, especially since upper extremity ability plays a huge role in how we approach bladder care. In this first group, individuals with C1 to C5 level injuries typically present with absent to very limited hand function. But that doesn't mean that there's no role for OT. We can support meaningful participation through positioning strategies, communication tools, and routines that preserve dignity, choice, and autonomy during care. In our next group, C6 through C8, we have varying degrees of hand function. We often see some functional use of the arms and wrists, and in many cases, the potential for partial or full independence with self-catheterization, especially with the right adaptive equipment. OT support here is critical. We can help build confidence, introduce equipment, and develop sustainable habits that support long-term success. And finally, for individuals with injuries at T1 and below, hand function is typically fully intact. Most people in this group can manage their catheterization independently, barring any other factors like mobility issues or comorbidities. Even here, OT can play a big role in helping fine-tune routines, streamline the environment, or help support the transition to community living with more efficient systems in place. Okay, now that we've reviewed these functional groups, let's take a moment to review some of the common challenges that we see at this stage in the rehab process. We've got anxiety around the idea of self-catheterization, limited understanding of the urinary system or anatomical landmarks, reduced bed mobility or transferability, often tied to poor trunk control or upper extremity weakness, lower extremity spasticity interfering with body positioning, decreased dexterity due to level of injury or weakness, difficulty managing lower body clothing or lower extremity positioning, and poor visualization due to body habitus or low lighting. So these are the kinds of barriers that we're thinking about as OTs when we use the adapt-modify approach to support bladder management. So without further ado, let's get into AE options. First, we have positioning and access aids. These tools help clients get into and stay in the best position for catheterization. Examples include wedge cushions, grab bars or bed rails, transfer boards, adjustable bed or toilet setups, the eagle board, leg spreader, or leg spreader with a mirror. These are particularly helpful for clients in the C1 to C5 range, but also beneficial for C6 through C8 when positioning and stability are still a challenge. Next up, we have catheter guides. These support the actual insertion of the catheter into the urethra. For females, there's the Ask the Catheter guide, which helps angle and direct the catheter. Next, we also have the labia spreaders. This improves access and visualization in female anatomy. For males, we have penile stabilizers, and this could be as simple as wrapping a towel around the base for support. These are excellent options for the C6 to C8 group, helping bridge the gap towards independence. Next, gripping and dexterity aids. These tools help compensate for reduced hand strength, grasp, and fine motor control. Examples include universal cuffs or catheter insertion tools, built-up handles or angled grips, Velcro straps, custom orthotics, bungee cords for clothing management, for example, hooking clothes to the bottom of the wheelchair to maintain a clear working space, zipper loops or pull rings on clothing, or adaptive clothing with vertical zippers on the side or horizontal inseam zippers to improve access. These aids are particularly helpful for clients in the C6 to C8 range and promote more efficient dressing and undressing during these routines. Okay, now we have visual aids. Visual feedback is especially helpful when sensation is impaired. So we've got a few examples of mirrors that can be mounted, hands-free, or supplemented with an LED light. And sometimes you'll see options with the leg spreader with a mirror attached to it. These are relevant for all injury levels, but especially helpful for those with decreased trunk control or slightly seated supine positioning needs. On to timing and routine supports. Staying on schedule is essential for bladder health. Examples of these include phone alarms, reminder apps, and bladder diaries. These tools support consistency, whether the client is managing routines independently or with caregiver support. Sometimes overlooked are hygiene and disposal tools. Cleanliness matters for health, dignity, and confidence. These examples include adaptive wipes and cleansing devices, no-touch catheter disposal bags, or disposable underpads or peri-care supplies. These tools reduce infection risk and can be helpful across all entry levels, especially for clients working towards more privacy and control in their care. As OTs, it's not just about knowing what tools exist. It's about understanding the barriers, identifying client-centered solutions, and training clients to use equipment in a way that builds skill, independence, and confidence. And as always, our approach must consider not only physical function, but also comfort and long-term sustainability in everyday life. Thanks so much for watching this video on AE and bladder management. In our next video, we'll shift our focus on non-standardized bowel function assessment and how to incorporate it into your OT evaluation process. You won't want to miss it, so I'll see you in the next video.